do it, but we can chew gum and walk at the same time. Okay? I know they have a difficult time doing that, but we don't. Okay? So, fact of the matter is, we have certain good faith steps that we need to take in order to continue to move negotiations along. And so, we've made exactly the same offer that we made to the legislature on what to do with health benefits, no different. And so we'll see what happens. I still believe that the way we need to deal with this over the long term is to legislate this pension and health reform. It needs to be law, because what has happened time and time again over the course of this is that the CWA negotiates benefits and then leaves the negotiation table after signing the agreement and goes to the legislature to get them to codify those benefits. So that when you come back to the bargaining table the next time, you can't negotiate that portion. So, oh, well, that's the law now. That's off the table. Now here's our next set of demands, and our next set, and our next set. Well, you know, if it's good for them, it's good for us. And I still believe that the taxpayers of New Jersey, to be most protected, need to codify these pension and health reforms. $54 billion pension deficit, $67 billion underfunding in our health insurance plan. This cannot continue. That is the product of the collective bargaining that has been done over time by localities, counties, and the state. So, I believe, as I've said many times, in collective bargaining, I believe in hard, adversarial collective bargaining, where there's someone in the room who represents the taxpayers. That's what we're doing. And so, you know, all they're yelling and screaming and they're filing complaints and all the rest of this stuff, it's because they've never been in the room with somebody who actually knows how to negotiate. They don't recognize it. They think it's not negotiation. Because their version of negotiation is they put their demands across the table, the state hems and haws and then agrees. Not the way it's working anymore.